Welcome to the Wellness Surge podcast with Dr. Adiola Oke. Each week, we discuss our wellness journey with real people like you and me. We have conversations about food, fitness, mental health, financial wellness, and much more, so you can get back to the real you. To make sure that you're up to date with this and other wellness topics, visit wellnesssurge.com. Information presented here is for educational purposes only and is not intended to diagnose or treat any disease. Please do not apply any of the information presented here without first speaking with your primary care provider. Now, let's head on to the show.
Hello, everybody. Welcome to the Wellness Surge podcast. My name is Dr. Adiola Oke, and today we're going to be talking about effective type 2 diabetes management. Alrighty, so why is this important, right? So in the year of COVID-19, we're seeing that people with chronic diseases are having worse outcomes with the coronavirus infection, right? And so this is why this is important. And this is where we want to use this to empower ourselves, right? And empower people that we love so that they know how to manage their diabetes properly and how they could possibly prevent, right? Prevent themselves from having diabetes. So what are we going to discuss? Obviously, we're going to talk about diabetes, how to effectively manage type 2 diabetes, sick day management, and complications of diabetes. So a little bit about myself, right? I have worn several hats in the healthcare field. As a clinical pharmacy specialist, I work with patients to improve their health through diet, exercise, and of course, medications. Science continues to show that lifestyle managements are not inferior to medications, especially at the beginning of the disease process, and they are often more efficacious in stabilizing or reversing a disease. So you got that, reversing a disease. If you catch it early and you do the right things, you could possibly reverse diabetes. So you should also know that many classic drugs were originally derived from natural compounds. So because of this, I am very passionate about the medicinal benefits of foods to prevent and treat diseases. So what is diabetes, right? We all know diabetes is high blood sugar. So when there's too much sugar in the blood, that's when we have diabetes. So blood sugar, how does that come about? It's not just that the sugar gets into the blood. No, this comes from what you eat. So what you decide to put in your mouth decides how much sugar will be in your system. Right? So when we talk about diabetes, right, we talk about something called insulin. Insulin is a hormone produced by your body, and it acts like a key to a door. So this insulin helps glucose, the sugar from your blood, get into your cells where it will then be used as energy. So but in people that have diabetes, that is usually the problem. These people often don't have enough insulin, or the insulin is not working properly. So we then have sugar buildup. The insulin is not opening the door for the sugar to get into the cells. And so that's where we have diabetes, worsen cases of diabetes. So what are the types of diabetes? The most common types of diabetes are type 1, type 2, and gestational diabetes. Type 1 diabetes, in this case, the body cannot produce insulin. The immune system attacks and then destroys the cells in the pancreas that make the insulin. Type 1 diabetes is usually diagnosed in children and young adults, although it can appear at any age. People with type 1 diabetes need to take insulin to stay alive, okay? So in this case, there's nothing you can really do. It's just that's how your genetics is, that's how your body is. But in the case of type 2 diabetes, that is a totally different case, all right? In this case, your body does not make or use insulin properly. You can develop type 2 diabetes at any age, even during childhood, sadly, because in this day and age, a lot of children are eating a lot of high sugar foods and causing obesity and possibly diabetes for themselves. So that type 2 diabetes is the most common type of diabetes. And then lastly, the other one is gestational diabetes. This is diabetes that occurs in some women when they are pregnant. Most of the time, this type of diabetes goes away after the birth, thankfully, all right? But however, keep this in mind, people with gestational diabetes have a greater chance of developing type 2 diabetes later on in their life, right? Sometimes diabetes diagnosed during pregnancy is actually type 2 diabetes that they didn't even know, right? So we said that type 2 diabetes is the most common form, so that's what we're going to be focusing our talk about today. So let's just keep some statistics in mind, right? Every 17 seconds, someone is diagnosed with diabetes. about 23 million people in the United States have type 2 diabetes. But now here, listen to this. But about 7 million of these people don't even know that they have diabetes. So this is when you will then start hearing cases of, oh, this person died of coronavirus, or this person is so sick from coronavirus, but they didn't know there was anything wrong with them. That's because about 7 million people don't even know that they have diabetes, right? So let's just keep that in mind right now. Diabetes is the 7th leading cause of death in the United States, all right? So now let's focus on African Americans. 50%, they are 50% more likely to have type 2 diabetes when compared to Caucasians. They're 2 times as likely as Caucasians to die from type 2 diabetes. They're 3 times more likely to have type 2 diabetes related adverse effects and amputation, right? And 4 times more likely to have end-stage kidney disease when compared to Caucasians. So this statistics is mind-boggling, all right? And as a beautiful race, we can do better than this. So what are the causes of type 2 diabetes? Well, one, we have several, but there's one you can't do anything about, and that's the genetics, right? If you get the genes from your mama and your papa, I'm sorry, there's nothing you can do. There's no way that you can change that, okay? But there are ways you can control it, all right? So genetics is one. Another will be being overweight. Another that will be lack of physical activity, like just sitting around and telling people not moving around as much. That will be a problem. And then another is insulin resistance, right? So what is that? Insulin resistance is when cells in your muscles, fat, and liver don't respond well to the insulin and can't easily take up the glucose from your blood. So in this case, the key is not working properly for the sugar to get into the cells. So who is at risk? Well, people that are age 45 and above, they're one of the people that are at risk for diabetes. And then people that, have a family history of diabetes, like that's the one I said you really can't do anything about, is from your genetics. Mama and papa, thank you. Okay, being overweight or having physical inactivity, right? So when you have a lot of fat, right? The more fat you have, the less likely the insulin in your body is able to work appropriately, right? If you have a history of gestational diabetes, then, like I said, you're already at risk. We already talked about being African American, right? And the statistics. What African race here puts us at risk. I don't know why, but it does. That's what the statistics show. People that have diabetes while pregnant, like we talked about, they're already at risk of having it later in life. So certain drugs also increase your risk of insulin resistance. And so these medications include like the steroid shots or steroid injections, steroid medications, medications for mental health conditions and HIV medications. These medications, they put people at higher risk of having higher blood sugar and possibly developing diabetes if they don't already have it. So what are the signs of high blood sugar, right? People start to feel very tired. The 3 big ones that I look for are frequent urination, frequent thirst. So you're going to the restroom all the time, you're thirsty all the time, and you're hungry all the time. Okay? So those are the 3 big ones I look for, but there's so many other ones. So how do we effectively manage type 2 diabetes, right? How do we do that? There are 3 main ways. One, exercise, right? Be active for at least about 30 minutes every day. You can either dance, you can walk, you can do something you love. That is the only way you can be consistent, and that is the only way you will actually do it, right? So you can start out with about 10 minutes every day. Actually, 10 minutes is too much. Start out with about 5 minutes every day, and then we're like, I can do this. Then you increase to 10 minutes. I can totally do this. Increase to 15, and then slowly build on what you love. And then you're exercising, you're being active, right? That's it. It's as simple as that. We just need to take baby steps and we get to where we're trying to go. Another is medications. That's not the focus of the conversation today. And then another is diet. All right. And you know how I like to talk about diet and using it to manage diseases and stuff like that. All right. So when it comes to your diet, right? You may worry that having diabetes means that going without foods, like a lot of patients, let me just say this, a lot of patients that I know, they're like, oh, you're going to talk to me about the foods I can't eat. I'm like, no, that's not what I'm talking about here. The good news is this. You can still eat your favorite foods, but you need to eat them in smaller portions. That's it. All right. So your fats, examples would be like your coconut oil, your cheese, your nuts, and then your proteins, right? Meat, chicken, fish, and we all know what carbohydrates are, like bread, rice, and things of that nature. Another one, important one, is vegetables, right? We need to keep this in mind. We have the starchy vegetables and we have the non-starchy vegetables. So the popular ones that people love to eat will be your fries, right? That is starchy vegetables, okay? And then the non-starchy ones will be like your leafy greens and your tomatoes and peppers. And then we have fruits, right? Fruits are sweet naturally. So we need to just know that they're sweet. And so when somebody has diabetes, you have to be very careful. Which one are you choosing to eat? Is it a low sugar fruit? Such as like your berries are really good as in low sugar, like your cranberries, your raspberries, your avocado, and or moderate sugar food, such as like your strawberries, your grapefruits and cantaloupe, or is it high sugar food, such as like dried fruit? So that's when you start to get in trouble. Dried fruits, dates, things like that. Those dried fruits, right? The sugar becomes concentrated in the dried fruit. And so someone that has diabetes, that's just going to make your blood sugar go up really high. So the good news is this, just a small amount is all you need. Aim to eat about 5 servings of vegetables and 2 servings of fruit every single day. We need to keep this in mind. How much sugar is in your drink? We all know that the best drink you can possibly have is water. There's no sugar in it. Okay, so for the other drinks you like to enjoy, a Coca-Cola, fruit juices, like you say, oh, it's juice. No, honey, it is juice, but it is concentrated sugar. The amount of sugar in your juice is very close to the amount of sugar in your Coca-Cola. Yes, it is a lot. So it's better that you eat the fruit than drink the juice. All right. If you don't get anything from this today, make sure you get that. It is better to eat the fruit than drink the juice. Alrighty, so we have to talk, when it comes to diet, right, we have to talk about something called glycemic index. Glycemic index is a system that ranks foods on a scale from 1 to 100 based on their effect on blood sugar levels. The smaller the number, the less impact the food has on your blood sugar. So the general rule of thumb is this: white foods often have a high glycemic index. That means they make your blood sugar shoot up really fast, all right? Versus foods of other color, they don't do that. In general, we like to say out with the whites, all right? So like your white bread, you can replace it with white rice that is not white, right? Like your brown rice. Oh, sorry, did I say that? Let me say that again. Like your white bread, you want to replace it with breads that are not white. So like your whole grain bread would be a better alternative. Your white rice, you can replace it with brown rice, things like that. Your potatoes, your white looking potatoes, you can replace this with sweet potatoes. But if you choose to eat these foods that have high glycemic index, you just want to have very, very little, especially if you have, this is only pertains to people that have diabetes. You just want to have very small amount, because if not, it will make your blood sugar go up really high. Okay, this is something else. I like the slide, right? So this is something you need to keep in mind. Should you be limiting the amount of ice cream you're taking, juice you're drinking, Coca-Cola, soda, cupcakes, donuts, cookies, pancakes, sugar? Should you be limiting that? So that's just food for thought for you, okay? And only you can answer that question. So what else? What else can we do to effectively manage diabetes? One is control your A1C. So you may hear your healthcare provider talk about A1C. So what is this, right? A1C is the average blood sugar for the past 3 months. And this is a number you cannot cheat on. You should set up an A1C goal with your provider because it's not the same for everybody. It all depends on your weight and other disease states you have. So it should be individualized. Other things you can do, if you have high blood pressure, try to keep your blood pressure below 130/80. And so things you can do will be like to eat foods rich in potassium, such as banana and things like that. If you have high cholesterol, work to keep the cholesterol under control. If you smoke, I invite you to quit. It's not easy. It is a journey. It is the process, and it is totally doable. You just need to ask for help. All right. You want to limit the amount of alcohol you're taking because alcohol can increase your blood pressure and things like that. And that's it. All right. So just keep this in mind too. E-cigarettes are not a safe option because they contain other harmful ingredients in them. And we've seen that, right? We've seen that from history. So because these things get inhaled into your lungs. So when we talk about high blood sugar, we need to talk about the comparison. Low blood sugar, what are the causes? Well, if you're taking so much medicine that you need, yeah, your blood sugar will go down. It will cause too much, it will cause low blood sugar. If you don't eat when you're supposed to eat, or you take medicine and you don't eat afterwards, your blood sugar will go down. If you exercise excessively but you don't eat to balance it out, your blood sugar will go down. And alcohol can actually sometimes lower blood sugar. So if you choose to drink alcohol, make sure that you eat because while you're drinking too. What are the signs of this low blood sugar, right? The bigger ones are like shaking, sweating. It can be any one of this. Dizziness, being hungry, of course. Your heart will maybe beating really fast. Your vision starts to become blurry. You're having a headache. Yeah, that's a very common one. You start to get irritable. But keep this in mind though, I am more concerned about a low blood sugar than a high blood sugar. Why? Because a low blood sugar can kill somebody way faster than a high blood sugar. That's why. Okay? So we all want to keep diabetes in check, but we want to make sure that we don't go to the extreme end of over-treating or being excessive in our ways that we then have low blood sugar, which can kill somebody way faster than a high blood sugar. All right? Especially in the elderly population. So how do we treat this low blood sugar? Well, check if you start to feel like dizzy, like your heart is beating really fast, you're hungry, you're irritated and things like that, check your blood sugar right away. If you start to notice that you have, if your blood sugar is less than 70 milligrams per deciliter or 3.9 millimoles per liter, then you have low blood sugar and you want to treat it based on the rule of 15. Okay? So what does that mean? Rule of 15 means eat or drink 15 grams of carbohydrate quickly. Okay, so what are those? My go-to will be easy, tablespoon of sugar, right? If you don't have that in the house, tablespoon of honey. If you don't have that in the house, a glass of milk, 4 ounces of fruit juice, or 4 ounces of regular soda, not diet. Diet won't work here. Or 3 to 4 pieces of glucose tablets or hard candy. So those lollipops, this is where they come handy. And I usually tell and encourage patients, especially those people that live at home, make sure you have this go-to items by your bedside. So the easy go-to item will be like a lollipop or like a butterscotch hard candy. They're not for you to be snacking on. They're just for the emergencies. So you wake up in the middle of the night, you're feeling dizzy, lightheaded, having headaches, you're sweating, you're like, oh, I'm having low blood sugar. Even if you don't have time to check it, you know that you have that emergency sugar next to your bed because you don't want to get up when you're feeling that way. If you get up, you can break a bone, you can break a limb, and that has more effects. Like that is a lot of pain and a lot of money that you will have to spend on that. Okay, so please keep something by your bedside. This is always my favorite, right? How to lower blood sugars naturally. I really enjoy talking about natural therapies, and if you can use the natural, then so be it, right? Food that has been shown by science to help lower blood sugars include black seed. So about 1 gram twice daily usually does no trick. Another is psyllium husk, about 10 grams to about 22 grams per day, but you have to kind of spread it out throughout the day to help lower your blood sugar. And cinnamon, that's a very popular one, and oats. So the fiber in the oats are really good for you. And that also usually helps with cholesterol too. Be sure to tell your healthcare provider though, if you're taking any supplements to lower your blood sugar, because like I said, a low blood sugar can kill somebody way faster than a high blood sugar, all right? So in this case, your healthcare provider can possibly reduce the medications they ordered for you, okay, if needed. We can't do diabetes management justice if we don't talk about sick day management. When you're sick, your body is under a lot of stress and it produces hormone to fight the disease. So this hormones then causes the blood sugar in your body to go high, right? So it's not you, it's just the illness process. And that's why you notice that when you are sick, your blood sugar just continues to go up and up and up, all right? So make sure you have a sick day plan before you're sick. When you're sick though, your sick plan should include checking your blood sugars every 4 to 6 hours, drinking a lot of fluid. Water especially helps like keep your body hydrated and kind of helps dilute the sugar and stuff. If you're unable to eat, try to drink soups, crackers, fruits, Gatorade, and things like that, and take your medications as prescribed. But have a plan that you have set up with your provider first, so that you know it's going to work for you. You want to make sure you have the sick day plan before you're sick, not when you're sick. Plan ahead. So why should you care? Diabetes can affect almost every part of the body. Some effects include stroke, heart disease, okay? And so this is what I'm talking about in the year of COVID-19. People with chronic diseases are having worse outcomes, so keep this in mind. It can affect the eyes. Diabetes can affect the eyes and cause blindness, all right? It can affect the kidneys and cause people to have to be on dialysis. Right, that's not fun either. And it causes nerve damage. So in men, right, this may manifest as erectile dysfunction. Also, in other people, right, everybody else, the nerves in your fingers and your feet and all that can get affected by this high blood sugar, and it can then start to cause numbness, tingling, pain. And believe me, talking to patients, that pain is not fun. Okay, so we recommend that people have diabetes check their extremities frequently. And this is why when you start to have numbness, tingling, pain, you may not start to feel that extremity anymore. So you want to make sure that every single day you put your hands and you just put it around your feet, right? Just make sure that there are no sores, there are no injuries that you did not notice because that part of your body may have now become numb. You can't feel anything. So that's why you see that sometimes people that have diabetes, they end up having amputation because they missed an injury because they were not checking their feet. They developed, and so maybe sometimes you'll see this. Some people actually put their feet in water and it gets burned because they can't feel it and they did not know. Or nail is stuck in there, they did not know, they didn't feel it. And then they develop an infection or something, and then they have to lose that extremity. And so that's not fun. I know that we've said a lot today and it may seem a little bit overwhelming, but I want you to know this. Type 2 diabetes is preventable and you can effectively manage it. Especially in the beginning, you can actually possibly reverse it with diet, exercise, and if needed, medications. The sky is the limit. The most important thing you can do today is take the first step. Like I was talking about exercise, physical activity. Start with about 5 minutes, then you can increase to 10 when you feel comfortable, but take the first step. Keeping your blood sugar under control can save your life, all right? I can cheat sheet for people that want foods that can help reduce inflammation in their body. So you can just check on my website, www.wellnesssearch.com, and you'll just get on there, a pop-up will show up and just put your name in there and you get your cheat sheet, all right? So stay tuned for our next episode about how a 470-pound Canadian man reversed his diabetes naturally and totally change his life. I hope you have a good week. Enjoy yourself. Bye-bye.
Join our Wellness Search Facebook community so that you can implement what we learned together. I am because you are. Thank you for listening and sharing your precious time with us. If you enjoyed the show, then follow us and subscribe on iTunes, YouTube, or any app that carries podcasts. Have an awesome week. Best wishes to see you thrive.